If you're getting ready to come into Medicare, whether you're turning 65 or you're about to retire and come into Medicare, you probably have gotten one of these in the mail. It's the Medicare and You Guidebook, kind of the holy grail of Medicare. And if you've seen my videos in years past, I generally go through this book page by page to explain to you everything that you need to know about Medicare. But this year, I've got something better, and it's easier to understand. So I'm going to go through it right now. I'll show you where to get both of them right now. Stay tuned.
Medicare on video, Medicare on video.
Okay, so let's get into it. I'm going to do a full overview of Medicare, really soup to nuts, A to Z. I'm going to show you everything that you need. So this is obviously going to be a longer video. I'm going to make it as simple as possible to understand every part of Medicare. And to make it easier, if you're watching this on YouTube, down in the description, it'll be broken down into chapters. So if you need to learn about a certain part, you can skip right to that chapter and it'll show you exactly what you need to know. So I'm going to go through, and like I said, in years past, I generally have gone through the Medicare and You Guidebook and kind of gone over what Medicare writes on Medicare, and it's not the most interesting read. So what I've done is I've taken all that information and I put it into a book, and I made this book easy for you to understand. And what makes it easy is, number one, there's lots of pictures. There's infographics that just make it easier to understand things. There's also videos that I have produced that are in the book. You simply click on them and it'll play the video. And it also has all the links that you need on where to sign up and how to get things and all that stuff that you're going to need now and in the future for Medicare. So it's a great thing to keep on your iPad or on your computer for future reference, because it contains pretty much everything that you need to know. So Medicare Made Clear is the name of the book, and I'm going to show you where to get it right now for free. You simply go to this URL, medicareonvideo.com/free book. It's going to bring you to my website, and it's simple. You put in your name and your email address, and you'll have that book right now, and you can follow along as I go through it right now. You can also, while you're on my website, if you go to the Medicare Guides and Forms section, I have a lot of stuff in here as well. You can download the Medicare and You Guidebook right here. Click on it. It'll download right on your computer. That way you have it now going forward. And again, I have a lot of information on my website, especially in the Guides and Forms sections. If you need that employer coverage form, if you're going to retire and you're past age 65, you have to show that you have group coverage coming into Medicare. So this is the form that you need right here, and it's pretty self-explanatory, but we're happy to help with any of it. Just give us a call. We'll walk you right through it. And again, look through here. You'll find all sorts of information in here. But right now, we're going to get right into Medicare Made Clear, go through it piece by piece, so strap yourself in. You'll see I've written this book to make it really kind of easy to understand. Obviously, Medicare is not super interesting to read about, but it's something you have to understand. So you'll find in the table of contents tons of sections. And I've made this so if you click on one of the sections, it'll bring you right there. So if you need whatever particular section you need to understand, just click on the blue link and it'll take you right there. It shows you which parts have videos as well, because a lot of people just want to watch me tell them exactly what they need to know. But again, I cover everything in this book. So getting right into it, you know, Medicare Explained. Why do they make it so complicated? And it really isn't that complicated, but I kind of relate it a lot of times to when I do my taxes. And taxes to tax people really aren't that complicated. But when I do my taxes, I go to my accountant. I don't want him to explain, and I don't want to become an expert in taxes. I want him to tell me exactly what I should do and find somebody that I trust in order to do that. And that's what we do, is we tell you exactly what we would do if we were in your situation. So I try to explain it that way to make it as easy as we can. But right now we're going to go through. A lot of people do want to get a pretty clear understanding of exactly what Medicare is all about. So when you go through here, first section, there's the first video, Medicare Explained. So this is the one I've done recently with the Medicare and You Guidebook. You simply click on it in the book and it'll start to play that video. You can see wherever there's a blue link in here, like this healthcare costs, if you click on it, it's going to take you to information on exactly what it's talking about. So we've tried to make this as simple as possible. So let's break down the parts of Medicare, and they are broken into parts. I don't know really why they make it so many different parts, but they are. So you have Part A, and when you have Part A, that's going to cover stuff that happens inside the hospital. So it's inpatient care, things like your inpatient hospital care, skilled nursing facility, nursing home care, hospice care, home health care. So that's all part of Medicare Part A, and it just breaks it separately from Medicare Part B. Medicare Part B is pretty much stuff that takes on outside the hospital. So doctor visits, outpatient care, home health care as well, durable medical equipment, and preventative care. So think of Medicare Part A as stuff going on in the hospital, Medicare Part B, stuff going on outside the hospital. And again, when you break it down into sections, it's really not that hard to figure out. Medicare Part C. Medicare Part C makes it more confusing. That is Medicare Advantage. So I'll get into that a little deeper when we get in. Your main choice when you come into Medicare is whether you're going to stay on original Medicare, which is A and B, or whether you're going to choose to go into a Medicare Advantage plan. And there are significant differences in those two choices, so I will break that down for you as well. You also have Medicare supplement plans. Medicare supplement plans go along with original Medicare. They do not go along with Medicare Advantage. So if you had Medicare A and B, you'll likely have a Medicare supplement plan, and then your last section, Medicare Part D, which is Medicare drug plans. So you got A, B, C, D, and Medicare supplements. That's kind of the entirety of the parts of Medicare, but you need to understand them. So first off, I have a video on Medicare Part A that's specific to just Part A. So if you want to get a deeper dive into Medicare Part A, click on that video. It'll take you there. And then here's one of our great pictures. This kind of explains Medicare Part A in an infographic. So what is Medicare Part A? Pretty much room and board. So it's inpatient hospital care, skilled nursing, nursing home care, hospice care, some home health care. It generally includes a semi-private room, meals, medications, nursing, lab services, and again, stuff that's going on inside the hospital. So that is what Medicare Part A is all about. Now, what does Medicare Part A cost? For the most part, there is no cost to Medicare Part A. So Medicare, you've been paying for your entire working life. So you've been paying taxes on Medicare for your entire working life. So when you get there, it's not going to be too much out of pocket. There are still some expenses when we come in. Most people think it's free. It's not exactly free. So we want to make sure we understand so we don't have any surprises. So Medicare Part A, you can see here, it does have out-of-pocket costs. So the deductible right now for Medicare Part A, if you are admitted into the hospital, is $1,484. Pretty big deductible when you get admitted in the hospital. It's right off the bat, first day, that's going to be your deductible. So that's where, if you stay on original Medicare, a supplement would come in, and it would generally cover that Medicare Part A deductible. So the last part, is Medicare Part A free? And the short answer is no for those that qualify. And then you talk about qualifying, it's generally if you have worked in your lifetime 40 quarters. So you need to have worked 40 quarters, which is pretty much 10 years, paying into that Medicare tax along the way, and then there is no cost for Part A. If you have not qualified under the 40 quarters, then Part A can cost $471 a month. So it's pretty significant, and it breaks down differently if you've come close to those 40 quarters. But generally, for the most part, for most people, Part A, there is no premium to Part A. And then cost sharing. What does it cost me when I use Medicare Part A? And again, this is stuff inside the hospital. It doesn't count stuff like doctor's visits, outpatient. So Medicare Part A has that deductible, $1,484, and that's per admission. So it's per episode, and it has a 60-day window. So if you go in the hospital and then you go in the hospital again 90 days later, you're going to have that same deductible again. So we want to make sure we cover that with a Medicare supplement plan, and that's exactly what a supplement does. So you'd have no cost out of pocket if you have a supplement that covers your Part A deductible. And then it's going to cover hospital days up to 60 days, and then days 61 to 90, you have a copayment of $371. And then after that, you're going to have a copayment up to 150 days of $742. So significant out-of-pocket costs. But again, supplement will cover that. So it sounds bad on Part A, but as long as we work it the way we're supposed to work it, then we really don't have any real out-of-pocket expense when we're in the hospital. And then for skilled nursing facilities, so if you're discharged from the hospital into a skilled nursing facility, Medicare Part A covers the first 20 days. And then after 20 days, 21 to 100 is $185 a day. And then after day 100, you're on your own. So you need to make sure you understand that. So Medicare is not set up to be long-term care in a nursing home. It's there for rehab when you are making improvement and going to return back to where you were previously. So when do I enroll in Medicare Part A? And it used to be not that long ago where it was automatic. When you turned 65, you automatically got Medicare Part A. But the problem with that was when you start Medicare, a lot of people don't know this, if you have a health savings account, for instance at work, where you put in pre-tax money into a health savings account that you can use for healthcare expenses, when you start Medicare, you can no longer contribute to that HSA. You can still use the money going forward, but you can no longer contribute to it. So what was happening is when they automatically started Medicare Part A, people didn't realize, and they were still contributing to an HSA account, and it got kind of messy. So now Medicare Part A is, you have to initiate it. So you do have to, just like Medicare Part B, you have to tell them that you want to start it. And if you're going to come into Medicare when you turn 65, that's when you want to start it. You want to start your A and your B when you're going to turn 65. If you're going to continue to work past age 65, you do not want to start Medicare Part A. You absolutely do not want to start Medicare Part B. I see people all the time that stay working after age 65 and they have started their Medicare Part B. Number one, they're paying a premium for the Medicare Part B that's completely useless. Number two, it makes things much more complicated when it is time to come into Medicare. And there are some caveats to that, of course. They make it complicated. And the main caveat is whether you work for an employer that has more or less than 20 employees. And I'm not sure how they figure that you're going to know how many employees your employer has, but that is a line, and we'll get into that a little bit later as well, on differences on how things work. So again, here in the book is a link. So when you need to apply for Medicare, if you got your book, you just click right on that Apply for Medicare button, and it's going to take you to the page on Social Security where you enroll into Medicare. Another big confusion for most people. You would think you would go to Medicare to enroll in Medicare, but it's not the case. You go to Social Security to enroll in Medicare. And I also made a URL to make it easy for you to get there. If you can't get to this button, just go to www.startpartb.com. Takes you right to that same page on Social Security, where you generally are going to be signing up for your Medicare Part A, your Medicare Part B, when it is time to come into Medicare. And when you want to do that is ahead of time. So if you can do it 3 months ahead of time, do it 3 months ahead of time. When you know when you're going to come into Medicare, go and sign up for the date that you're going to come in ahead of time, because especially these days where it's kind of crazy, super slow and delayed, and people working from home and things aren't the same as they used to be. So just do it early. It just makes it so much easier and takes the stress out of coming into Medicare. So enrolling in Medicare Part A, quick breakdown. So are you receiving Social Security benefits? So the difference is, if you're already receiving Social Security benefits, they're going to assume that you are not working because you're getting Social Security. So you're automatically enrolled in Part A if you are receiving your Social Security benefits. Part B will become effective the first of the month of your 65th birthday. So if you're born on June 29th it's going to be effective June 1st. So you need to understand that as well. And if you're drawing Social Security, your Medicare Part B premium will come out of your Social Security check. So they make it easy for you to pay for your Medicare Part B. So if you do not want your Medicare Part A and Part B because you're under an employer group plan or you're on your spouse's plan, you need to sign the back of your Medicare card and send it back to Social Security. Now, I wouldn't leave it there. I would absolutely follow up with a phone call and make sure it does not start. You do not want Medicare Part B to start before you're ready to come into Medicare, again, because it makes it super complicated, takes away some of your rights as you go forward. So if you're not drawing Social Security, you must actively apply for Medicare Part A. You must actively apply for Medicare Part B. They don't know that you're not working and that you're ready to come into Medicare. You need to tell them. And if you're turning 65, you can apply during your initial enrollment period, which is 3 months prior to turning 65. And again, understand that it's going to start on the first of the month of your 65th birthday. So if you're born on the 10th of the month, it's going to start on the 1st, except if you're born on the 1st of the month. So I'm not sure why they complicate it this way either. But if you are born on the 1st of the month, it's going to start on the 1st of the previous month. So if you're born on June 1st, your Medicare is going to start on May 1st. So super important to understand that as well. So you need to do things well ahead of May 1st, even though you're born on June 1st, to get everything in place and make sure that it's nice and easy and seamless. And again, that's what we do. We help. We walk you through it. We get all your pieces in the right places so that there aren't any surprises, because really you don't want to mess this up, and it can be complicated if you do mess it up. Last thing you want to do is miss that start date if you're coming in at 65, because if you go past that, it really jumbles up everything that you have to do, and I'll talk about that in a little bit as well. So now you know everything you need to know about Medicare Part A. So that gives you a pretty good overview of Part A. And again, go back to that picture. It's stuff in the hospital for Medicare Part A. So when you get to the end of it, that's all you really need to know. And there's not a lot to it. And again, if you have a Medicare supplement plan, you're really not going to have any expenses under Medicare Part A. So it's pretty good stuff. So here we come to a part where I'm going to ask some commitment from you. So if I'm going to sit here and go through Medicare for the next 30 or 45 minutes, I need you to just leave a comment below the video. The comments below videos are what makes things kind of go viral. So it gets it out in front of more people. So you can do a big favor to me and a big help for me. Just leave a comment below. It doesn't have to be anything more than thank you or good stuff or this is boring or whatever you want it to be. And I will personally respond to every comment that is left on the video. So please take half a second. Just put a comment below the video. If you want to get really nice, like the video, subscribe to the channel. That way you'll always have access to my videos going forward. And it just helps me tremendously. It's what tells YouTube that this stuff is worthwhile. Okay, so moving on to original Medicare Part B. So this will be the section on Medicare Part B, which obviously is different from Medicare Part A. In the last section, we talked about Medicare Part A covering stuff that goes on inside the hospital. Medicare Part B covers stuff that goes on outside the hospital. So important to understand kind of how they function, although when you go to have stuff done, you pretty much give your Medicare card and it knows what's going on. So it's nothing you have to do to make something happen differently inside the hospital versus outside the hospital. Simply present your Medicare card and things will happen the way they're supposed to happen. So when we get into Medicare Part B, it's kind of easy to understand. Another one of our pictures that makes it a little bit easier to understand. And again, Medicare Part B is stuff that's outpatient. So things like medically necessary services, preventative services, doctor visits, outpatient care, preventative care, home health care, durable medical equipment, mental health, clinical research, things like that, stuff that happens outside the hospital. Anything that's inside the hospital, pretty much Medicare Part A. So you can see down at the bottom, same information without the picture. What does Medicare Part B cover? And then probably more importantly, what does Medicare Part B not cover? And Inpatient services, so stuff that goes on in the hospital, that's under Part A. Also doesn't cover dental, vision, and hearing, and that surprises a lot of people, but it's generally just like stuff you had at work with your medical insurance, where you had a separate dental, vision, and hearing plan, and that's the same with Medicare. Dental, vision, hearing would only fall under Medicare if it were like in a car accident or something like that. It's not standard dental coverage or vision coverage or hearing coverage, but there is a separate policy for that. So there are policies designed for people 65 and older for dental, vision, and hearing. We can obviously help with that as well. Medicare Part B, hospice care, prescription drugs are not covered. That's covered under Medicare Part D. And then long-term care, cosmetic surgery. Obviously, long-term care is not covered under health insurance. It's a whole different scenario. So it doesn't cover long-term nursing care, but it does cover rehab in a skilled nursing facility. So medically necessary services are like what they're supposed to be. Generally, Medicare is going to cover anything that's medically necessary. So if your doctor is saying it's something that you need, I don't ever hear Medicare denying something like that. So, and that's on original Medicare. It can be different under a Medicare Advantage plan because decisions are then made by an insurance company versus being made by Medicare. But Medicare, pretty good stuff, and it works pretty much exactly the way it's supposed to do. And, you know, I relate a lot of times in videos where I have thousands of clients and I literally get 0 customer service calls. If I get a call once in a month, that's a lot. And it's usually somebody that misplaced their Medicare card and is looking to figure out how to replace that. But for having stuff covered, it's pretty much black and white and works just the way it should. So here I have another video on Medicare Part B, and I kind of go over this stuff, you know, really detailed in Medicare Part B. These aren't long videos. They're maybe 3-4 minutes, but it's a little more detailed of exactly what Medicare Part B is. You can also see a little blue link there for Part A. If you click on any of the blue links, it'll take you to the page that has all the information on whatever the blue link is talking about. So make sure you look through all that and take advantage of it. And will Medicare Part B cover all of my outpatient needs? And the answer is generally yes. As long as it's medically necessary, that's what it does, and that's what it's for. So again, A, in the hospital, B, outside the hospital. So whether it's outpatient surgery, if you're gonna, you know, have a colonoscopy or something like that where you're not admitted to the hospital, it's gonna fall under Medicare Part B. What are the costs for Medicare Part B? So this is important to understand. So Medicare Part B, unlike A, does have a premium. So Medicare Part B has a premium which is currently $148.50 a month. So it's $148.50 a month for Medicare Part B for most people. That premium is income adjusted. So what surprises a lot of people is if you have more income than you're supposed to have, going forward while you're in Medicare, you're going to pay more for your Medicare Part B. You're also going to pay more for your Medicare drug plan, Part D. So important to understand that. It's called IRMAA, and it's income-related monthly adjustment, something or other. I go through that in a little bit also in this video, so we'll talk about that. But that $148 can go up to as much as $400 and some a month. So it can be significant, especially if it's you and your spouse together. Your Medicare Part B premium can be high. So I think the first line before it goes up is annual income of $70,000. And again, important to understand in how they calculate it, it's based on income 2 years ago, because that's the tax information they have access to is 2 years ago. So a lot of times people made money 2 years ago and don't make as much money now. So you have to appeal that, and I'll show you how to do that. We have the form and the instructions and all that stuff to make it easy, but it's important to understand. So here are some more links in the book where if you click on Medicare costs at a glance, it'll take you to the page that gives you a pretty easy breakdown, Social Security benefits, things like that. And then how do you sign up for Medicare Part B? Pretty much the same way as Medicare Part A. When it is time, you know you're going to come into Medicare, you need to do it early. And if you're going to do it at age 65, it's going to start on the first of the month that you turn 65. So if you're born on June 10th, it's going to start on June 1st, unless you're born on the 1st of the month. If you're born on the 1st of the month, it's going to start on the 1st of the prior month. So if you're born on June 1st, it's going to start on May 1st. So if that's the case, if you are a 1st of the month baby, then you need to set this stuff up super early, because it's going to start 30 days ahead of when you actually turn 65. So make sure you understand that and get it done when you need to get it done. So here's that Apply for Medicare button again. If you're in the book, you just click on it, and it's going to take you right to the page on Social Security of where you sign up for Medicare Part A and Medicare Part B. And it's really not too complicated. And believe me, you want to do it online if it's at all possible, because these days trying to call or make an appointment or things of that nature can just get really, really drawn out, long wait times, things of that nature. So if you can do it online, click right there, do it online. And then what does Medicare Part B not cover? And again, doesn't cover the stuff that Medicare Part A covers. Doesn't cover things that are inside the hospital. But outside of that, pretty much, as long as it's medically necessary, it's obviously not going to cover cosmetic surgery or things of that nature. So, it's pretty easy to figure out. And again, it works just like it's supposed to work. So very few complaints on how Medicare A and B work, with the exception of maybe some out-of-pocket costs, or if you got to pay more premium for your Medicare Part B. Obviously not good stuff, but we need to understand it so that we don't have any surprises. So what are your out-of-pocket costs for Medicare Part B? So Medicare Part B does have an annual deductible. It's $203 a year right now. And that goes up usually a few dollars every year, but $203 deductible annually, runs January to January. You pay it once per year. Chances are, if you're coming off health insurance right now, you have a $1,000, maybe even a $5,000 deductible. So $203 annually, pretty small for medical coverage going forward. Once you have that deductible paid, Medicare pretty much goes into 80-20, where they're going to pay 80% of the bill. You're going to be responsible for 20% of the bill, which is actually pretty good. That's kind of how insurance used to be in the old days. You had 80-20 coverage, where you're responsible for 20% of whatever is going to be charged. Now, with Medicare, if you have a supplement plan, it's likely going to cover that 20%. So you're likely to only have that $203 deductible for the year for anything that's outside the hospital. And then the supplement's going to cover pretty much all of the out-of-pocket for in the hospital. So again, super low out-of-pocket on Medicare. You can have a slightly less Medicare supplement plan that might add a $20 copay when you go to the doctor. But again, very, very good on the out-of-pocket expenses for Medicare A and Medicare B. So what is the late enrollment penalty for Medicare Part B? You want to do it when you're supposed to do it, because if you don't do it when you're supposed to do it, they do give you a penalty. And there's a 10% penalty annually for every year that you waited. So if you're supposed to sign up for Part B, now keep in mind, if you're on regular employer group coverage called creditable coverage, then you do not have to sign up for Medicare Part B. If you are not on creditable coverage, you do have to sign up for Medicare Part B. Actually, you don't, but if you don't, there's going to be a penalty when you do. So what a lot don't understand is employer retiree coverage is not considered creditable coverage. So if you're on retiree coverage, you work for a big employer and they provided retiree coverage, and then you go into Medicare later, you're going to have this penalty because it's not considered creditable coverage. Also, COBRA is not creditable coverage. So if you're on COBRA, you need to come off of COBRA. You're probably paying an arm and a leg for the COBRA. Come off of the COBRA and go into Medicare when you're supposed to go into Medicare, or else there will be a penalty down the road if you go into Medicare later. So here we are again, and please leave a comment. So my throat's getting a little dry talking about Medicare. I'm hoping the least you'll do is leave a comment below the video. Helps everything just go a little more viral and gets the video out there, and it's a big help to me to get YouTube to say, hey, yep, we need to show this to more people because it's good information. So just take a minute. I'll respond to every comment personally. put something good, put something boring, whatever you want to do. Sounds good to me. So now we're going to move into the next section. So now we're going to talk about Medicare eligibility. So the big question is, when are you eligible for Medicare? And it's really not that complicated, but there are some other things when you're starting to get in that range of figuring it out. Obviously, at age 65 is when most people come into Medicare, but Social Security starts as early as 62. And so some people think that at 62 you're ready to come into Medicare. That's not the case. They've changed now where full retirement age for Social Security used to be 65, but now it's gradually increasing. It's up to like 67 and a half now because we live longer and work longer and things of that nature. So our Social Security not going to start as early, but Medicare kind of has stayed the same. Pretty much 65 unless you have creditable coverage, employer group coverage generally, where maybe your employer pays a big part of it, so you don't really want to come off of it, and you keep that until you're ready to retire, and then when you retire is when you're going to look to come into Medicare. So it's not that complicated, but seen people miss it all the time. So here's a video on Medicare eligibility. Again, I break it down a little more detailed and it's a little more specific. So if you're in the book and you want to watch that video, just click on the video. When can you enroll in Medicare? Most people will become eligible at age 65. So you want to do it early. If you know you're going to come into Medicare when you're going to turn 65, your kind of window opens up 3 months before. And again, keep in mind the fact that if you're born on the first of the month, it's going to start the first of the prior month. So it's going to open up 3 months before then. So that's when you want to do it. Now, I certainly have people doing it the day before they turn the month of 65. But we want to do it, at least a month, 2 months ahead of time. Just put it all to bed. And that way you don't have to worry when it actually comes along to make sure that you've got everything in place. So there's other times if you're under 65 that you could come into Medicare, and that's if you're on Social Security disability. So right now you have to be on Social Security disability for 2 years before you become Medicare eligible. So a lot of times if you go on to Social Security disability at the end of 2 years, you'll have open enrollment for Medicare. So an important thing to understand, let's say that happens in your 40s and you go into Medicare and now you're going to turn 65, you get a brand new window. Even though you're already on Medicare, when you turn 65, you can make changes and pick plans without any medical questions. So make sure if you are currently on Medicare due to disability before 65, when you are turning 65, let's review your options because we might get some better opportunities. And again, no questions asked when you're turning 65. So it makes a lot of difference in what your out-of-pocket expenses might be. So here we have a button for an eligibility and premium calculator. And it's actually a pretty good tool. If you click on it, it's going to take you right to Medicare's site where they have a whole calculator on when you're eligible and what your premiums will be for everything that you're going to be looking at going in. So take advantage of that as well. Part A eligibility is pretty much the same, as regular Medicare. So it's generally when you're turning 65. And again, it used to start automatically when you turn 65. But now if you're going to continue working and you're not drawing Social Security, it's not going to start automatically. You have to initiate it when you're ready to come into Medicare and make sure that you get your pieces put in the right places. And the cost for Medicare Part A premium, as we talked about before, there is no cost for most people. As long as you've worked 40 quarters, 10 years, you've paid into Medicare for that period of time, then there is no cost for Medicare Part A. Medicare Part B, little different, same eligibility rules where you're going to sign up when you're ready to start Medicare, whether it's at age 65 or whether it's when you retire. I've had people work until their mid-80s and then start Medicare in their mid-80s, and it's just like they're turning 65. Obviously we don't want to work into our mid-80s, but some people do. Some people enjoy what they're doing, which is terrific. And then when it's time to retire, your Medicare works just like when you're turning 65. So no medical questions. As long as you have credible group coverage, then you have no medical questions coming in. So your Part B premium in 2021 is $148.50, so it's going to cost $148.50 a month. Again, important to understand, it's income based. So if you make north of $70,000 a year going forward past whenever you come into Medicare, your Part B is going to cost more, and it can be significantly more. So we'll talk about that a little bit later. And just important to understand so you don't get a big surprise when your bill comes for your Medicare Part B. So here's how it works if you do it correctly versus not doing it correctly. So with your Medicare Part B, it's a time frame to sign up, and if you miss that time frame, it makes it complicated. So the regular way, and let's talk about if you're turning 65, 3 months before your birthday is kind of when your window opens, and you want to do it absolutely in those 3 months. If you go to sign up for Medicare during the month of your birthday, so if you're born June 16th and you wait until June 2nd, because remember, Medicare is going to start on June 1st if you're born in the middle of June. If you wait till June 2nd, then it's going to start the month after your birthday. So then it's going to start on July 1st. So not too big a deal. If you go to sign up the month after your birthday, so if you're born June 10th and you wait till July 2nd to sign up, it's going to start 3 months after your birthday. So July, August, September 1st. So you may be without medical coverage for that period of time. If you wait till the second month after your birthday, it's going to start 5 months after your birthday month. So I don't know really why they do this, because it doesn't really change behavior. It's usually a mistake that has caused somebody to miss their timeline. It's not because they wantonly tried to work the system or something like that, but you can see it's a problem. So if you are going to come into Medicare, especially at age 65, and you know that, you want to do it ahead of time. So do it ahead of time. Give us a call. We'll walk you right through it. Make it easy. Make it simple. And that way, the month that you turn 65, you'll already have your Medicare card. Everything will be in place. It'll start the first of the month that you turn 65, and then works just like it's supposed to do. So again, we've talked a little bit about retiree coverage and COBRA coverage, how it's not considered creditable coverage. So if you're on retiree coverage or COBRA coverage and you foresee yourself in Medicare, you want to do it now. So you want to get off of that retiree or COBRA coverage and start your Medicare, or else there's going to be a significant penalty down the road, and that's a lifetime penalty. It goes on and keeps going on. So you just want to make sure that you do it correctly. And if the delay is needed because of other insurance, let us go over it, and we'll make sure that it's creditable coverage and that it's not going to cause you a problem down the road. So Medicare Supplement and Medicare Advantage eligibility kind of roll right along with regular Medicare eligibility. So on a Medicare Supplement plan, when you first come into Medicare, you have a window where you can pick anything you want, and they can't say no. So you can choose whatever plan you want without any medical questions, and it doesn't make any difference what type of medical health you're in. You can choose what you want, and it'll be covered under the Medicare Supplement plan. And again, that's what we do, is we make sure we get the right plan in the right place. So you have additional options for Medicare Advantage, which is called Part C. And I make no secret of it in my other videos. I'm not a fan of Medicare Advantage. I don't recommend Medicare Advantage. It certainly plays a big part in Medicare, because probably about half the people are on Medicare Advantage and the other half people are on original Medicare with a Medicare Supplement plan. But the differences to me are pretty great, and where they differ the most is on flexibility. So with a Medicare Advantage plan, it takes you out of Medicare, and I'll go over this in just a minute as well, and kind of put you in control of an insurance carrier, versus original Medicare, you're still on Medicare. And you can go to any doctor, any hospital in the country without asking permission. And that's probably the biggest thing for me on why I would choose to stay on original Medicare versus a Medicare Advantage plan. But some will disagree with me. If you disagree with me, put it in a comment below and let me know. And what I generally find is people are thrilled to death with their Medicare Advantage plans until they go to use them. So as long as you're healthy, you know, it works terrific. It's when you become not healthy to where you need to make some major decisions and have big things happen as to where you want more control. And that's where original Medicare gives you all that control and flexibility, where a Medicare Advantage plan may not. Medicare Part D eligibility, drug plans, same kind of thing as a supplement, runs in the same fashion. When you're turning 65, that's when you're likely going to get a Medicare drug plan. It may be included in a Medicare Advantage plan, so you don't have to separate it out. If you stay on original Medicare, it is a separate piece that we need to make sure we get the right plan that goes with your current medication. So also, it takes a little bit of legwork to make sure we do it right, but you want to do it when you're supposed to do it. And there is an argument on a drug plan. You know, if you don't take any drugs, should you be buying a drug plan? And, you know, I have my own feelings that I've put out in some other videos where I don't think I would if I don't take drugs and don't need a drug plan, because you can get a drug plan at the end of any year. But there is a penalty if you don't get it now. But to me, the savings and premium kind of outweighs the penalty. So, but again, that's a conversation to have, and whatever makes somebody sleep better at night is how things pretty much should work. So that gives you a pretty good idea on eligibility and kind of covers most of the pieces. So now we're going to talk about some frequently asked questions on Medicare eligibility. So this makes it a little bit easier. These are kind of the major questions on what exactly you might have confusion on. So is everyone 65 or older eligible for Medicare? And unfortunately, no. First and foremost, you must be a U.S. citizen, permanent resident, who has lived in the U.S. for at least 5 continuous years. So get a lot of people that have lived outside the country and then come back. So you need to have lived in the country for at least 5 consecutive years. At what point do I qualify for my Medicare benefits? If you age into Medicare, then your qualification age is 65. It doesn't matter if you've applied for any Social Security benefits or not. So generally, if you're turning 65, that's when you qualify for Medicare. And then if you're still working, it will be at what date you retire. If I'm under 65, when do I qualify for Medicare? And again, if you're under 65, to become Medicare eligible, you need to be on Social Security disability for 2 years, and then you become eligible for Medicare. I'm 62. Can I enroll in Medicare? And the answer is no. You need to wait until age 65 unless you are on Social Security disability for 2 years. How early can I apply for Medicare benefits? And due to the 7-month enrollment period, you can apply for Medicare up to 3 months before you turn 65. So again, we want to do that. So there's a 7-month window. I don't even know why they make it 7 months, because it can be problematic if you wait till the end of that window, and it's wrapped around your birthday month. So it's 3 months before your birthday month, and 3 months after. But if you wait till those 3 months after, it can definitely be problematic when you sign up for Medicare. So we want to do it in the 3 months before your birthday month. How long do I have to work so I can be eligible for Medicare? And again, for Medicare Part A is free if you have worked at least 10 years. And 10 years is 40 quarters. It could be split up, but if you've worked 40 quarters, and it could be the same for your spouse. If you're married and your spouse has worked for that period of time, it functions the same. Is signing up for Medicare mandatory? And it's not mandatory, but if you don't sign up when you're supposed to, and then you want to sign up later, there can be penalties involved in your Medicare going forward. So you want to run on the timelines like you're supposed to. When it comes time to Medicare and Medicaid, who is eligible? So for those 65 or older that have specific disabilities, Medicare will be your health insurance system. However, Medicaid is a federal and state joint program that'll provide benefits to those who have low incomes. So depends on your situation, and that can be kind of another help scenario where I have some information on that as well, which we'll go over in a bit. Am I eligible for Part D of Medicare? Runs pretty much the same as Part A and Part B. When it's time to come into Medicare, that is when your Medicare Part D eligibility would start as well. How to find out about your Medicare eligibility. So it can be tricky and challenging because there are a lot of different enrollment periods, and most people just get overwhelmed with the number of different things. So again, that's where we help. If you have any question or are confused at all about any of it, just give me a call and we'll tell you exactly the way it should be, and make sure that you get your sign up done when it's supposed to be done. So that gives you a pretty good overview on Medicare eligibility. Please leave a comment again. So if you're finding this helpful, just help me out a little bit. Leave a comment below the video. Just makes it more accessible to other people. The more comments we have, the farther the video goes. So take just a minute and leave a comment below, and then we'll talk about our next section. Okay, so let's talk about Medicare enrollment periods. So different than your eligibility, we need to know what specific enrollment period we're in and how it works. And there are multiple different enrollment periods. And again, why they do this, I can't tell you. It just makes it complicated for people to figure out exactly what they're supposed to do. So here we have another blue link, enrollment periods for Medicare. If you click on that, it's going to take you to one of my pages that show you specifically the enrollment periods, but we're going to go through them right now so that we understand them. We got another video. So I have a video specifically about enrollment periods, and I can tell you, it confuses me sometimes on when exactly you fit into which enrollment period. Obviously, turning 65 is not a hard one, but the rest of them can be a little complicated. So there are 4 Medicare enrollment periods. There is the initial enrollment period. There is the special enrollment period, the general enrollment period, and the annual election period. And the annual election period, they also call it open enrollment period, which I don't know why they create different names. And again, we'll get into it here in just a second to understand them and know when we need to deal with them. So Medicare initial enrollment period. That's pretty simple. So this one's not too hard. This is when you're turning 65 and you're going to come into Medicare, like the majority of people, but it's not that big of a majority because a lot of people don't come into Medicare until later if they're still working. But if you're going to come into Medicare at age 65, there is a window. And again, it's kind of a silly window, but it's a 7-month window wrapped around the month of your birthday. So 3 months before the month of your birthday, 3 months after. This is your sign-up period. But if you do it in that 3-month after part, it's complicated. You don't want to do that. If you're going to come into Medicare at age 65, we need to do it within that 3-month period before the month of your 65th birthday. Let's make it a little more complicated. If you're born on the 1st of the month, your Medicare is going to start the 1st of the previous month. So if you're born on June 10th, your Medicare is going to start on June 1st. No big deal. So we want to do it 3 months ahead of June 1st. If you're born on June 1st, your Medicare is going to start on May 1st. So we need to do it in the 3-month period before May 1st. So super important to understand that if you happen to be born on the 1st of the month. If not, it's going to start on the 1st of the month of your 65th birthday, and you want to do all your sign-up stuff well in advance of that. And again, this is how we help. So no cost to you to let me help you. Please give me a call. We'll make sure we get it done correctly and everything in the right place. So here's, again, that what I was just talking about on complicated if you do it after your birthday. And I went over this in a different part of the video, but if you do it 3 months before the month of your birthday, it's going to start on the first day of the month of your birthday. If you do it during the month, so let's say you're born on June 10th and you wait until June 2nd to sign up for your Medicare, because you don't turn 65 till June 10th. Why do I need to sign up before I turn 65? Well, you do, because it's going to start on the 1st of the month. So if you wait till June 2nd, it's not going to start until July 1st. So you're going to waste the whole month of June where you may not have coverage because you waited. If you do it the month after your birthday, it's going to start 3 months after your birthday month. If you do it all the way waiting till the 3rd month after your birthday, it's going to start 6 months after your birthday month. So obviously important to do it. And if you wait longer than that, you go into a different enrollment period, which I think we're going to talk about here in just a second. Here we go. If I miss the initial enrollment period, what's going to happen? Well, if you have credible coverage, no big deal. So if you're still working and you have group coverage, then no big deal. That's going to be with you until you're ready to come into Medicare. And again, I've had people work well into their 80s with group coverage, and then they retire and they come into Medicare, and it's just like turning 65 because you have creditable group coverage going through. Now, what's important to understand is creditable coverage. So that's regular group health insurance. It could be individual insurance, but it's generally regular group health insurance. What it is not is COBRA insurance. If you're on COBRA, you need to get off the COBRA and come into Medicare when you're supposed to come into Medicare. You're probably paying an arm and a leg for the COBRA anyway. Or retiree coverage. A lot of times people have retiree coverage and they keep it past when they're supposed to come into Medicare, and they really should have come off of it and gone into Medicare. So if you do that, number one, it's going to mess up your enrollment times, and there's also going to be penalties. So that's a big deal when you have a penalty, and it can be 10% per year that you wait. So anyway, it's lifetime. So we want to do this when we're supposed to do it. So just make sure that if you don't know, give me a call and we'll make sure that we walk you through it the way it's supposed to be. Special enrollment period. So a special enrollment period, unlike a initial enrollment period, is if you're still working. So if you stay at work past age 65 and you don't want to come into Medicare, you probably don't. If you have employer coverage and they're paying for a lot of it, or maybe paying for all of it, then you're probably going to keep that until you're ready to retire and come into Medicare. Now, something people don't understand also is if you're the employee and your spouse is on your plan, a lot of times it's a much better idea for the spouse to come off and go into Medicare, because Medicare is generally much better coverage at a much lower cost. So the employer generally doesn't pay for the spouse part of your health insurance. So if you are the employee and you're going to continue working and your spouse is on your coverage, probably a very good idea for them to come off, go into Medicare. It'll have better coverage, lower costs. But again, give us a call and we can figure that out if it makes sense. If it doesn't make sense, then we want to stay on the employer coverage. So another scenario that makes this complicated is whether or not your employer has 20 or more employees. So if they have less than 20 employees, then Medicare would be primary. If you have your employer coverage, if there's 20 or more, the employer coverage would be primary. So you don't want to have both of them really in just about any scenario, but it's important to understand that on how it functions. And again, it's not so easy in a quick video, but give me a call and we can walk through it. Medicare, general enrollment period. So this one's crazy. So if you messed everything up and you missed your enrollment time and now you're even 6 months past your birthday and you need to come into Medicare, you then go into the Medicare general enrollment period. So what this is, so let's say you were supposed to come into Medicare at 65 and for whatever reason you did not. Now you're 67 and you need Medicare, you need health insurance, and you need coverage. Well, if you're in that scenario, you have to sign up for Medicare between January 1st and March 31st. That's the only time you can sign up. And then it's going to be effective July 1st. So you have to sign up in that 3-month period at the beginning of the year, and it's still not going to be effective until July 1st. So you want to make sure that you do it when you're supposed to do it. If not, it can be very complicated. And I've seen people, for whatever reason, just not do it when they're supposed to do it. And then when we try to get it to where we're supposed to get it, it just gets that much more complicated. Okay, annual election period. So this one's always fun. So this is at the end of every year. So if you've ever seen Joe Namath on TV, or even Mike Ditka's doing them, all these Medicare commercials at the end of every year, where that's the only thing. You have political ads, you have Medicare commercials, your mailbox is filled up with all this Medicare Advantage information, how we're the best and join our plan. So this is the annual election period. So every year between October 15th and December 7th is the sign-up period during the annual election period. And where this applies to, primarily Medicare Advantage plans. So if you are in a Medicare Advantage plan, at the end of each year, you can change. You can go to a different Medicare Advantage plan without having any questions asked. Also applies to Medicare drug plans. So drug plans and Advantage plans are what fall under the annual election period. So if you need to make a change to either your drug plan or your Medicare Advantage plan, you need to make that change between October 15th and December 7th, and then it's going to take effect on January 1st. So if you got into a Medicare Advantage plan and they lost a bunch of their doctors and your doctor is no longer there and you want to go to a different Advantage plan, maybe where your doctor is now, that's when you change during October 15th to December 7th. You make the change, comes effective January 1st. So if you're on a drug plan and your medication's changed and your drug plan that you're on doesn't cover your new medications very well, or there's a different drug plan that covers them better, that's when you make the change. You make the choice between October 15th and December 7th, and it's going to take effect on January 1st. Where people get a little confused, this does not apply to Medicare supplement plans. If you're on original Medicare with a Medicare supplement plan, you don't have to wait till the annual election period. You can change a Medicare supplement plan anytime during the year. The caveat with that, in most states, you have to be medically underwritten. So when you first got it, there weren't any questions on medical. When you have it now, if you want to change to a different one, if you got some rate increases and you want to get a lower cost, then you have to apply and answer some health questions and be medically approved to be able to apply. That's in most states. In some states, they have other birthday rules or year-round open enrollment. So there are a number or a handful of states that offer some other protections that make it easy to change your Medicare supplement plan from one to the other. So again, that's where we come in and figure out exactly the best way to handle it and make sure you get the lowest cost for the best plan. So the value is what is super important. I'll go over Medicare supplements here in a minute and show you kind of how they work. So once we're through the Medicare annual enrollment period, we have Medigap open enrollment. So Medigap, which is the same as Medicare supplement, open enrollment is at the same time you're coming into Medicare. So you have that same window if you're going to stay in original Medicare to pick a Medicare supplement plan with no questions asked. So we just want to make sure we get the right one with the right company at the right price. And just, again, that's what we do. We make it easy to figure it out. Here's another picture kind of talking about that annual election period that happens at the end of any year. Green light on October 15th, red light on December 7th. So you got to make your choice between the green light and the red light, and then it's going to take effect on January 1st. So that's all part of Medicare Advantage. And again, make it pretty clear I'm not a fan of Medicare Advantage, but that doesn't mean it's not right for certain folks, but it just, to me, is too restrictive and too complicated, and the out-of-pocket can be too big. And they make it sound terrific. They tell you how they're going to give you all sorts of free things when you come in. And Joe Namath will tell you, like, rides to the doctor and meals at home and things like that. But just understand, make sure you take a close look, because that is marketing 101, trying to get you into a Medicare Advantage plan. So why do they want to get you into a Medicare Advantage plan? Most people don't know this either. Medicare, if you join a Medicare Advantage plan, Medicare pays that Medicare Advantage plan about $1,000 a month to take you off of Medicare. So that way Medicare no longer has responsibility for your claims. It's all in the Medicare Advantage plan. So Medicare finds it beneficial to spend $1,000 a month to not have to adjudicate your claims and be responsible for whatever costs are going to be involved in the future. So Medicare Advantage doesn't do it as any favor. They're looking to get as many people as they can because it's a significant premium to them to have that. So here I have a video on Medicare Supplement versus Medicare Advantage and why you might want one versus the other and the differences that I see. So again, Medicare Advantage plans are run by insurance carriers. So it can be any of the major insurance carriers, and they generally have a network of doctors, they generally have a network of hospitals, and you generally have to stay in that network of hospitals and doctors, and can be problematic if you travel. So, and a lot of times, most people that retire want to travel. So if you do travel and you're outside of the service network, again, it can be problematic. It's more like an HMO type environment where sometimes you have to have referrals and things of that nature. And I can tell you that's the number one complaint, is having to get a referral from a primary care to go to a specialist before you can go to the specialist. You got to make an extra doctor's appointment, and just not stuff that I'm a big fan of. So I absolutely find original Medicare with a supplement just to make life just much easier. So what are the costs with a Medicare Advantage plan? Are they free? And some of them advertise free. Some of them talk about how they'll give you money back to join. They'll pay your Part B premium. And, you know, anybody's parents that ever brought them up correctly certainly told them that if it sounds too good to be true, it probably is. So just make sure you take a close look and know exactly what you got. And one of the differences, if you go into Medicare Advantage and you want to come back to original Medicare, you can come back to original Medicare at the end of the year. But to get a Medicare supplement plan, you would have to qualify medically. So if you are not in good health condition, you probably could not get a Medicare supplement plan. If you originally stay on original Medicare and a Medicare supplement plan and later decide you want to get into a Medicare Advantage plan, you can do that at the end of any year without any questions asked. So you can go from Medicare supplement to Medicare Advantage, but you can't necessarily go from Medicare Advantage to Medicare supplement unless you're in good health. So the out-of-pocket on a Medicare Advantage also can be significantly higher. It can be as much as $75.50 out-of-pocket in 2021, where original Medicare with a Medicare supplement plan, super low. So when we talk about Medicare supplements, we'll go over that as well. So you're spending on Medicare Part C. A lot of people don't understand this either. If you join a Medicare Advantage plan, you're still going to pay your Medicare Part B premium. So no matter what, you're going to pay your Medicare Part B premium. You may also have a premium for your Medicare Advantage plan. You may have a deductible, you may have co-pays, you may have out-of-pocket expenses in that Medicare Advantage plan that you don't completely understand until it's time to use it. So just make sure you take a very close look. You need to understand the networks of doctors and hospitals. And again, you'll have friends that'll tell you theirs is wonderful, and it's generally because they don't use it much. So that's, you know, the best way. Anything's terrific until you need to actually get in it. So here, you know, I say the main reason I don't generally recommend Advantage plans is they limit your choice on doctors and hospitals, where you have to use certain networks of hospitals or doctors. And if, God forbid, something catastrophic comes along, and as we get older, chances are something catastrophic is going to come along. And if you want to choose to go to Mayo Clinic or wherever it may be, I want to be able to go. And I don't want to ask permission to be able to go. And I certainly don't want them to tell me, no, you cannot go. So that's generally why I would choose original Medicare over Medicare Advantage. And again, you'll get different opinions from different people, but that's your first major choice when you come into Medicare, is whether you're going to stay on Medicare Original or whether you're going to choose to leave Medicare Original and go into a Medicare Advantage plan. If you'd like to talk about it, let me know. If you have a comment, here we go again. We need comments under the video. If you have had a good experience with Medicare Advantage or a bad experience with Medicare Advantage, leave it in a comment. Let me know. I will respond personally to every comment, but also helps everybody else reading, helps promote the video so YouTube puts it out in front of more people. So take just a minute, leave a comment, super helpful to keep the video rolling. So I'd appreciate it, that's for sure. So as we go forward, what are Medicare supplements? So Medicare supplements also are called Medigap plans. So that confuses people right off the bat. A Medigap and a Medicare supplement is exactly the same thing. There's no difference. Why there's two names, I have no idea. Medigap makes a lot of sense because it pretty much covers the gaps in Medicare A and B. So when you have original Medicare A and B, there's a big deductible on A, there's a small deductible on B, there's co-insurance on B, there's some extra co-pays on A for hospital stay. Supplements are designed to cover most of that. So it's a good idea. It's generally something you're going to have if you stay on original Medicare. You're generally going to get a Plan G or a Plan N that's going to cover what Medicare A and B do not. So it's important to understand that. Here I have a video on the best Medicare supplement plans in 2021. If you're in the book, click on that. I go through what I think are the best choices and limit your confusion on why there are so many different options and things of that nature. So Medicare, the best part about, I mean, this is one of the best parts about Medicare, and why they don't do this more, I don't know, but with Medicare supplement plans, they made them standardized. So they are exactly the same. A Plan G is a Plan G. It doesn't matter if it's with Aetna or Mutual of Omaha or Cigna or United Healthcare. It's exactly the same benefit. So it makes it really easy to compare apples to apples when we're trying to find the value in a Medicare supplement plan. It would be wonderful if they made Medicare Advantage plans standardized so you know exactly what you're getting when you buy it, but unfortunately it's just not the case. But with Medicare supplements it is. So here's another video. I go through the top three, F, G, and N, and show you the differences between F, G, and N and which you might want. And again, it depends on what they cost and what part of the country you're in, because they can range differently and sometimes significantly in different states. So we want to make sure that we look specifically at your zip code, know exactly what the costs are, and then we pick the right plan. And again, that's what I do, and that's what we do to make it easy, is we look as if we are you and then tell you what we would do. And you know, it's likely going to make the most sense for picking the right plan. So a few things that Medicare supplement plans do not cover. And a lot of people say, does a supplement plan cover this? Does it cover that? And it's really not up to the supplement plan. It's up to Medicare. A supplement plan covers the same stuff that Medicare. If Medicare covers it, the supplement has to cover it. There's no decision based on the Medicare supplement plan. I tell people all the time that really the company, you'll never have any interaction with a Medicare supplement company, because the Medicare supplement company, the insurance carrier, whether it's Cigna, Aetna, United, whoever it may be, is making no decisions. They do not approve or disapprove of any medical procedure. It's strictly based on whether Medicare approves it. If Medicare approves it, the supplement has to approve it. And a lot of people ask, well, does my doctor take this carrier? Doesn't make any difference there either. If the doctor takes Medicare, he has to take the Medicare supplement. And what a lot of people don't know is Medicare is actually the one that pays the doctor. And then they get the reimbursement from the Medicare supplement company. So the doctor really has no interaction also with the Medicare supplement company. So again, I get zero customer service calls on the thousands of clients that I have when they're using their Medicare and their Medicare supplement, going to the doctor, going to the hospital, whatever it may be. It works like clockwork the way it's supposed to do. You know exactly what your out-of-pocket expense is going to be, generally very low. But Medicare supplement plans do not cover hearing, vision, dental, because Medicare doesn't. Doesn't cover hearing aids, because Medicare doesn't. Contacts, eyeglasses, so forth and so on. Same stuff Medicare does not cover. So the benefit of having a Medicare supplement plan, on everything that is covered, it's going to limit your out-of-pocket expense significantly. And a Medicare supplement plan usually is in the range of about $100 a month. So it's not an expensive thing to have, but it can save you thousands without a doubt. So way better than those extended car warranties that are on TV these days, where you probably won't use them, and then you're talking about getting approvals and things like that. With Medicare supplements, no approvals, covers what Medicare covers without having any permission granted. So you don't have to ask if it's okay. So there's no referrals needed. If you want to go to a cardiologist, you go to a cardiologist. You don't have to go see a primary care first to get a referral to go see a cardiologist. You don't have to ask if it's okay. Now, sometimes a cardiologist might not see you unless you've gone to see somebody else, but you do not have that limitation with your coverage. You simply go to do what you want to do. You cannot be dropped due to a health condition. So once you have a Medicare supplement plan, it's yours. As long as you pay the premium, it's yours to keep. You can avoid extra costs that may come out of your pocket throughout the year. So again, very affordable for all the health part of it. And like I say here, original Medicare with a Medicare supplement plan gives you control over your health care. The freedom to choose where you want to go and do what you want to do. So yes, I'm a big fan of original Medicare with a Medicare supplement plan. Likely a drug plan if you've got a history of prescription drug use in the past, and it kind of just all goes together. And once you have it together, it's just something you won't think about going forward because it does exactly what it's supposed to do. So that's kind of where we are with Medicare supplement explanation. Now we're back to leave a comment. So tell me what you think about Medicare supplement plans. Does that make sense, what I say, that it just makes life easy and something that you don't have to think about going forward? And again, leaving a comment helps me out tremendously. I'm going to keep pumping on it, so you need to leave a comment down below. If you're with me now, I mean, I'm about an hour 15 into this video. Leave me a comment, tell me what you think, and it's helpful to me. We're going to now get into Medicare Part D. So now we're going to talk about Medicare Part D, which is Medicare drug plans. And where Medicare made things nice and simple with Medicare supplement plans by standardizing them and making them the same from one company to another company, they forgot to do that with Medicare Part D. So they did not standardize anything with Medicare drug plans, with the exception of some coverage areas. And I'll show you that in a minute. Medicare drug plans, unfortunately, are complicated, and they take some understanding. And if you have significant prescription use in the past and you foresee significant prescription use in the future, you're really going to want to understand how they work so that you can manage it the best you can. The best part about Medicare drug plans is you can change at the end of any year. So if you're in a plan that is not the right one for you, at the end of the year, you can change to another plan without any questions that may be a better fit for the medications that you're taking. So with Medicare drug plans here, another video on Medicare Part D. So I go over it more specifically. If you're on the book, click on the video. It's going to play right for you right there, and hopefully will help you figure it out. But we're going to get into it and kind of talk about what exactly it is. So what is it and how much does it cost? And there is a premium for Medicare drug plans, and it can vary significantly. And it really depends on deductibles and tier coverage and things of that nature. The more the deductible, the lower the premium. The lower the deductible, the higher the premium, obviously. So where your out-of-pocket expense is going to come from depends on the type of drugs that you take. So again, I get a little frustrated with this because it is complicated. It's even complicated for me to try and figure out and understand, but we want to make sure if, again, you have significant prescription use, that you understand the 4 coverage periods of a Medicare drug plan. So this is how Medicare drug plans are set up. You have an initial period, which is your deductible period. So you're going to pay whatever your deductible is in that initial period. So in other words, you go to the pharmacy, whatever that drug costs, you're going to pay for it until you reach your deductible. So your deductible could be as much as $400 or it could be lower than that depending upon what plan you pick. And again, depends on how much use you think you're going to get. And if things change during the year, you can change your drug plan at the end of the year. So once you have met your deductible, you then go into your initial coverage period where you have coverage that's based on tier levels. So tier 1, tier 2, tier 3, tier 4, whatever the drug falls in will be kind of how it works. And again, I think I have a little more explanation in a minute, but it can be kind of complicated to figure it out. But if we need to take a deep dive into it, that video will help that was on the previous page. Once you have exceeded your initial coverage period, you then go into the donut hole. And the donut hole you've probably heard of, where it's kind of a gaping hole in a drug plan where you're going to pay most of the cost until you then get into the catastrophic level. So if you've had a lot of prescription expense during the year, you will finally reach the catastrophic level where your drug plan will kick back in. So it's obviously something we need to understand, and we need to make sure that based on the type of prescription drugs you require, that you get the right plan. So if you, and it really won't come down to premium, if you take a lot of expensive drugs and you need a good coverage, you're probably going to want to pay more in premium to get better coverage than if you take little to no drugs. You're probably going to want a lower premium with lesser coverage. So again, it takes a little thought to figure it out. Medicare drug plan premiums are also income-based. Like we talked about Medicare Part B. They fall under the IRMAA rule, where if you make more than X amount per year, and it starts somewhere around $70,000, your drug plan cost is going to go up X amount of dollars per month as well. So again, important to understand and figure it out and make sure that we manage it correctly. You can see right down here at the bottom, we have a blue link to a IRMAA related page that'll give you all that information specifically on the income levels and how much it will increase a Medicare Part D plan. So it's important to understand that Medicare drug plans are not standardized like our Medicare supplement plans. That means they can vary greatly in coverage. So we have to really put it in and figure it out and figure out your cost sharing parts and so forth. So back to a Medicare Part D drug plan video and the stages of coverage. So this is where it's going to help you figure out on your stages of coverage. And let's see if we can walk right through them. So stage 1, and I really don't find humor in this, but it's funny, in a not funny way, and having to figure this out, and why Medicare doesn't make this part better, I don't know. But stage 1 is your deductible, and depends on what deductible that you set up, but they are set by the Medicare and Medicaid Services Division, and every drug plan will have one. And again, the higher the deductible, the lower the premium, so forth and so on. So the other stages, I go over in that video, and again, I just can't get into it deep on this video, but the other video that was on that page will go deep into those different categories of coverages. So voluntary enrollment into Medicare Part D, it is voluntary, so you don't have to have a drug plan. And there is different thoughts on, let's say you don't take any prescription drugs and you generally haven't taken many prescription drugs your entire life, and that's kind of where I am. I generally would have some aspirin and things like that, or something generic. Should you enroll in a Medicare drug plan? And the lowest cost Medicare drug plan is about $17 a month. Runs somewhere around there. Can be a little bit higher, but somewhere around there. But if you do not get a drug plan when you're first eligible, and then you want to get a drug plan later, there is a penalty. And that penalty runs at 1% per month or 12% per year. And it's based on the median cost of a drug plan. So if you don't get a drug plan now, and 3, 4, 5 years from now, you need a drug plan, it's going to cost more than what it would cost if you had it all along. Now, to me, you need to do some math on it, on whether it's worthwhile. To me, saving the $17, $18, $20 a month for 3, 4, 5 years is a pretty significant amount of money. It's going to cover that penalty for quite a while. So I probably, if I did not need a drug plan and did not have a history of prescription drugs, I probably wouldn't buy a drug plan. But that being said, a lot of people sleep better at night, having everything all buttoned up and not having to worry about a penalty or having to wait till January 1st in the future if you want to get one later. So again, that's a conversation to have, and I'm happy to talk about it with anybody. You can certainly leave your opinion below the video on what you think about whether you should buy a drug plan if you don't currently take prescription drugs. Does it make sense to do that? So that's kind of what exactly this information is all about, on whether to do it and then when to do it. And again, it falls into the special enrollment period, where at the end of every year, or the annual election period is what it would be at the end of the year, you can get a drug plan in a year. If you make your choice between October 15th and December 7th, and then it takes effect on January 1st, you can jump back in. So hopefully you find that helpful. We're back to comment section. So what are your thoughts on drug plans? And does it make sense to not get one if you don't take prescription drugs? So, and also if you've had bad experience, did you get sold into a drug plan that wasn't the right one? And that happens a lot because it's so convoluted. A lot of agents don't really understand them themselves, and they put people in the wrong drug plans. And the good part is you can change that at the end of each year. So again, happy to talk about it, happy to figure it out. And then also Medicare by state plans. There are a handful of states that do things different, and specifically Wisconsin, Minnesota, sometimes Connecticut, New York, California. They all have some different rules, which a lot of it's standardized across the country, but some states have some different rules, some different protections. Some of them make sense, some of them go a little too far in my opinion, but it's worth knowing. And I have this page on my website. If you click on this map, it'll take you there, and you can click on any state and it'll tell you state specific exactly what rules they have, and if they have different than other states, it's easy to figure it out from that part. Then we have a video on Medicare dental plans. So Medicare does not cover dental. Medicare is not part of dental, but there are plans for people in Medicare, and a lot of times they make a lot of sense. So it's important to understand that. You can learn that right from this video. We also have, other than dental, we have vision, hearing as part of it, and it kind of all goes together. A lot of people had dental, vision, and hearing at work, and then they come into Medicare and they no longer have that at work, so they need to replace that. So a lot of times you can find that. And what you'll find with Medicare Advantage plans, a lot of times they'll talk about including it, but it can be very basic coverage. So again, make sure you understand, if you are going to go the route of Medicare Advantage, that you know exactly what you're getting, and that it's not a bunch of fluff and not a bunch of things that sound good, but when it's time to use them may not be so terrific. But anyway, I hope you found this helpful, and hopefully you downloaded my book. If you didn't download it already, just go to medicareonvideo.com/free book, and you can put in your name and your email. It'll download right there. You can get the Medicare and You Guide in my Guides and Forms section. Hope you found all this helpful. Please leave a comment at the bottom of the video. Super helpful to me. And I hope you have a fantastic day.